Greetings, boys and girls, ladies and gentlemen. Happy 2020. Always curious to find out what entrepreneurs have in the way of New Year's resolutions. And of course, we're always talking to the mega entrepreneurs, the extreme individuals out there who are bucking the trend, setting the trend, and just, you know, being, as I like to call it, nothing short of being a badass in business. And so today I have the pleasure of getting to speak to one of the best orthopedic surgeons in the San Antonio area, if not bragging rights in being one of the best in the U.S. And you know that's the kind of people that we like to feature. We only like to bring you the best. It's just kind of a practice for us. And through the interview, you'll get to see why. You know, we're going to run the gauntlet today of understanding why orthopedic surgery and those who go out and set these trends and set these kind of standards of excellence, why you might not even be thinking that you're a candidate for orthopedic surgery. But if you don't take care of yourself the right way, trust me, trust Dr. Kuwamura, you're going to be a candidate. So allow me the pleasure of introducing Dr. Frank Kuwamura.
Well, thank you very much for having me on today.
Awesome.
I'm excited to be here.
Yeah, happy 2020.
Happy 2020, everyone.
Yeah, so any big resolutions for you?
You know, actually probably live a cleaner life, you know. It's all what we think about as mind, body, and soul.
I love it.
It's
really
so true. It's what we have to do.
It really is. So do you have like a standard of like clean living as far as like what you put in?
Absolutely. It starts with, you know, we have to do better. I have to do better in 2020 than in 2019.
Yeah.
It's the things we put in our body, the people we're around. It's really mind, spiritual, body, soul, exercising more, of course, losing weight. All the things I tell my patients to do.
Right. It's not just a New Year's thing. It's not just a 2020 thing. It's all the time.
It is. It's a life change. It's a way we should live our lives. You know, we try to do better every single year. And it's been a goal of mine always in my career.
So, I mean, you have such a robust background. You really do. I mean, for people who you've been nearly 20 years in the San Antonio marketplace, a leader in orthopedic surgery.
Well, thank you.
Well, I mean, thank you.
No, it's been a pleasure. It's a passion of mine to push the envelope, to do things that that we can do and help patients, and really look at cutting edge technology to bring them in people's lives, to change them.
So that being said, orthopedic surgery, your background, you have a very strong military background.
Thank you.
No, thank you.
No, yeah. That was actually some of the best things in the world I did. You know, I was proudly selected to serve in the military. I took a scholarship and played for graduate school in Boston as well as medical school, and then I trained at Bethesda Naval Hospital.
Bethesda, I mean, for people that don't know, Boston University is a mega school.
It is an amazing school. I was truly blessed.
And you did both your undergraduate and graduate?
Graduate school and medical school.
Medical school, that's what it is. Yeah. Okay, so what made you want to go into ortho?
It made sense. Things just made sense, you know. The background of breaking things and fixing things just makes sense to me, right?
Hopefully you're not breaking them.
I've broken a few things in my life, but certainly, you know, that idea of things making sense is really an important thing. And I really saw that we could change people's lives, and it really did. I mean, every time we saw patients, we did something to them, either helped them get better without surgery or do surgery, and we really changed lives.
Absolutely. So, okay, so you've been practicing for nearly 20 years. How many patients do you think you've seen over the years?
Oh my gosh, thousands and thousands. Even here in San Antonio, thousands.
I bet it's more than 100,000.
I think you're right. Over my career.
Over your career, for sure. What do you think is like this? So you do a couple really advanced procedures.
We do. We really try to push the envelope.
The MobiC and the XLIF.
Right. Those are two huge things we do to our patients. The concept of what we always have done is really don't hurt normal things. Do the surgery, take care of the problem, but really just don't hurt normal things, and it makes a functional recovery of the patient, makes their lives a lot better.
So let's talk about the MobiC for a minute.
Sure. Game changer. I've been in this for a long time. I was a trauma surgeon, I was an orthopedic surgeon, and then a spine surgeon. And there's very few things in my career that really were game changers, and this is one of them.
Why?
Because one of the things that we always do with surgery is what we try to do is restore function, restore someone back to as near normal as we can. When I talk to my patients, it's really, I can't fix you, I can't change you, I can only try to make your life better. Well, the artificial disc in the cervical spine has been done in Europe for a very long time. Just recently, within the last 3 years, we had the opportunity to do this in the United States. It's been a game changer. I can do a surgery on a patient, they can get back into their life within a week. And that's something I can't do that with other surgeries.
And you can do a neck surgery, you can do a back surgery, and somebody can be operational in a week.
In a neck.
In a neck.
Yeah. So our low back surgery, so artificial disc, hasn't been as promising. The cervical spine or the neck has been amazing. We have patients that, we have some of our patients are back delivering babies, going back, being a pro golfer, being a jiu-jitsu expert.
Yeah, I'm going to talk about that one.
Yeah, it's an amazing story.
Yeah. So, okay, so a neck surgery is about a week recovery time.
At the most.
A lumbar.
It depends on the type of surgeries. Some of our patients are back to working within a week to 2 weeks.
That's incredible.
It's really amazing what we do now.
So what makes you personally, Dr. Kuwamura, want to practice where you have such an emphasis on technology, and it's not just technology, but it also kind of incorporates this how the body heals itself?
It's always been my dream. I mean, honestly, to help people, number one, and that sounds cliche, but I really saw the difference between what we have always done in the medicine and what we could do. And the answer, even back to my early professors, the answer is, why can't we? Why can't we do something? Why can't we push the envelope? And that led me to research and developing products that I could then bring back to our patients. And we see it every day. I am truly blessed to see my patients in the San Antonio market here, and them come up to say to me, look, thank you so much for changing my life. And a lot of times it's the new things we did to the patient, the customized surgery we do for them. It's not the standard things that sometimes they're offered.
I can't imagine. So the jiu-jitsu.
Yes.
Tell us about Mr. Jiu-Jitsu.
Well, can I say his name?
Yes, for sure.
So shout out to Jamie Smith. Jamie was a patient of mine.
Jamie.
Hey, Jamie, how you doing? So he was a patient of mine and came to me, and he was like I was a fourth or fifth opinion. Okay. And he was a gentleman. He's a professional surfer plus jiu-jitsu.
Okay. Wow, professional surfer.
Professional surfer. And he had a bunch of injuries in his career, and he came to me with really a fourth or fifth opinion. All the other doctors that had seen him said, we're going to fuse your neck, which means we're going to stop the motion. And he came to me and said, if that's my only choice, I have to give up what I love, which is jiu-jitsu and professional surfing.
Wow.
I said, no, we can offer you, functional recovery. So we performed his artificial disc about 3 or 4 years ago. At that point, the biggest thing in the world, he said, he came to one of his post-op visits and he said to me, he goes, you're not going to be happy with me. And I said, what, Jamie, how are you doing? He goes, well, I'm doing really great, but that's not really, and gave me this picture of him, autograph, and it had, at that point, #1 in Texas, jiu-jitsu.
Wow, after
the surgery, and this was probably about 6-7 weeks after I performed the surgery.
6 or 7 weeks?
Yeah, it was nuts. And so Jamie said, you're not supposed to do this. And I said, well, okay, well, no problem. And he kind of went away because he was doing really well. And then he came back to visit me again. He goes, you're really not going to be happy with me now. I go, what? He gave me another autograph picture, and I got to take a picture with him, #1 in the world in jiu-jitsu last year.
Dang.
So currently he's disappointing. He's #2, but I said, Jamie, you get,
you need to get back in for more treatment.
And he's coming back for his shoulder, and we're going to do some stem cells in his shoulder, and so that's what held him back. He says, my neck's great. I just need some more work on my shoulder to kind of get back to being #1 again.
Wow, amazing. That's like, you think about that. That's like 50 days.
Maybe. Yeah, it really was amazing.
And he's getting #1.
#1 in Texas.
And there are some injuries that are more predominantly affect the joints and the spine.
Oh, absolutely.
And jiu-jitsu. I'm not a jiu-jitsu expert.
I'm not either, but I've seen some of his pictures and some of his videos he's shown me, and I would cry. Some of the beatings that he takes and really inflicts beatings on other people is amazing.
So if you could tell the 20-year-old Jamie or your sons,
right,
what would you do different? Like if you could go back, if Dr. Kuwamura could go back to when he was 20 years old and knowing what you see in the operating room,
right,
when patients come in the door, how would you change how you live your life?
Well, that's a great question. I think that before I would say don't do those things. We've all done stupid things in our lives, and so have I. I've done more than I can probably count. But what I would say now is with our technology, I'd say go for it. Go for your life. Be who you want to be. Go and do the things that really make you happy. Because now we can help you, and we can help you with amazing technology. We can help you with rebuilding your body with stem cells, or with injuries, or we can put artificial things in you that work extremely well.
Yeah, and I can't reiterate. I have somewhat of a personal testimonial, not personal, but from my circle. You really do. You really do give people a completely new perspective on how you can heal them and how you can treat them. And people who, like Jamie, they come in thinking that life's over. Life is over.
Yeah, he came in really distraught and said, I have no other choice. I said, no, you don't. Look, let me show you the research. Let me show you what's been done in Europe, and let's go for it. And Jamie was like, sign me up. And literally, you know, he spent one day in the hospital, went home the next day, and he says, it's changed my life.
Wow.
Which is, you know, one of the most gratifying things we do as doctors.
So the takeaway from that is live your life the way you want to. Go play your impact sports.
Go do what you want to do. You know, be smart. I mean, don't do crazy things, but you know, but certainly, you know, don't change who you are, and don't change what you love to do.
Okay, so stem cells.
Yeah, big thing. My background's really in microbiology and immunology, so I was actually a researcher in Boston before I went to medical school. So stem cells is huge. We've known about stem cells, and I've been doing stem cell research and treatments for probably 15 years. And so they're amazing cells that live in our body.
And you use those as a practice for every patient that...
Pretty much every surgery I've done, I use some form of stem cells, and it's the patient stem cells. And stem cells are amazing cells that our body produces. They're healing cells. They're healing cells, and also they're regenerative cells that can rebuild and regrow. So why not use those? I mean, they're ours. They're ours.
I guess for the layman out there, they don't realize that every surgery, I mean, at least in practices like yours, it's just there's no question. It's a standard that we have.
It's my standard. You know.
How many doctors do you think treat like that?
Well, I think that so I think that if you had asked me that question 5 years ago, I'd say I'm probably the lone ranger there.
Really?
But now I think the science now is catching up with, and at least getting out to some doctors, and they're incorporating that in their practices to help patients.
That's really remarkable.
It is. It's amazing. And I think it's just the beginning. And what's exciting in my world is we're just in the beginning of our understanding. We're in the golden age of development. There's so many things happening in our industry that is just crazy, that we are developing things. We're now doing 3D printing. We're doing a lot of things that can help patients.
3D printing.
Yeah, so
how does that affect the surgery?
It's crazy. You know, I was actually teaching 3D printing at University of Texas El Paso a couple of years ago.
Teaching it.
And so what we can do now is we can manufacture a piece for you that's unique for you. Because you and I and everyone, we're all unique, and we all have differences, and you know, our bodies change and our bodies are different. So now we can engineer a piece, either a replacement piece or substitution piece, or any type of piece that's unique for you and unique for me.
It's wild. Like,
it's crazy.
The world of
science fiction now.
Right, it really is.
Yeah, it really
I was
is.
hoping by 2020 I would at least see some flying cars by now, but at least in the medical world, it is getting a little bit.
Wait for Tesla to come out. I'm sure Tesla will do it.
Oh, right.
Yeah.
Right. Have you seen that new truck?
I've seen the truck.
Yeah, it's pretty.
I haven't put down my $100 yet, but you know.
I see Lori's watching. Lori Hagee, this is her facility. Hey, Lori, she's got hers on order, and I think I'm going to do mine too.
It's a pretty badass truck.
It is.
Right.
It really is. Speaking of trending in the news, I bet you were very happy on December 29th when they fired the whole coaching staff.
Oh yes. Oh yes.
For those of you who don't know, you've got one of the most diehard Cowboys fans in San Antonio.
I think I was in the womb of Cowboy fan.
Oh, really?
Yeah. No. Yeah. Been a Cowboy fan forever. You know, love Jason Garrett as a person and all those things he's done, even as a player for Cowboys. But you know what? It's time to move on. We have such great players in the Cowboys, and we need to do better. We can do better.
Exactly. I had to ask. I was thinking about burning my jersey, but I said, you know what? I'll bring it to Goodwill. So I might go back to Goodwill and ask for it.
You have a Jason Garrett jersey?
No, I have just a Cowboys jersey.
Okay. No.
So I might get it back.
You get it back. Yeah. A true fan is when we're doing bad, and we've been doing bad for a long time. Yeah.
I'm a big cheesehead, but that's for another conversation. Okay, so let's circle back. Okay, so as far as knees and backs and joints, like, what do you think is the biggest thing to avoid? What's the biggest pitfall out there when people are? I mean, I know you're saying we can engage in our sports, we can do our impact stuff, but like women? I mean, we're all wearing these heels. Is that affecting how you're seeing patients?
I think it is. You know, so what do we do? So a couple questions here. What do we do? If we're going to engage in activity, we really have to prepare for it. You know, like I think of life as a sport. If you're going to be out there doing things, think of it as a sport, as an athlete. You know, prepare, exercise. You know, live the right things. And when you do those activities, you're less risk to an injury. High heels. I think high heels really aren't good. You know, for women.
They look good.
They look great, but are they really good for the feet and the ankles and knees and back? Long-term studies show that's not.
So, ladies.
Sorry.
You heard from the doctor's mouth. No more high heels.
Well, you know what we saw when I grew up in D.C., what we saw women do with going to work on the subway. We saw them wearing sneakers, okay, right, carrying their shoes, and then when they're at work, they wear their shoes, and when they're done, they put your sneakers on. So
there you go.
It's a compromise.
Right. Okay, so you personally, What do you think is your greatest, I'm going to ask you about your greatest professional accomplishment, but what do you think personally has been your greatest?
You know, I have 3 amazing sons. I really do.
You have to say that.
No, I do. No, I really
I mean,
do.
you do,
No,
but
I really brag about myself all the time. They really have great foundations. I have an eldest that's 22, going to be 23, that's graduating from Regis University in Denver. I have a senior in Antonian, and I have an 8th grader at Holy Spirit, and they make me proud. They're really good. Number one, they're good men. They're good young men. They have good foundations, and they really have the drive to do better in their lives. And as a parent, that's all you can ask.
Right. Well, I mean, apples don't fall far from the tree.
Well, we're blessed. We're truly blessed. You know, our children that I have is just amazing.
Mm-hmm. That's awesome. Okay, so your kids, and we have some of the studio audience.
We do, yeah. Mason, shout out to Mason.
Shout out to Mason. Okay, that's I love that. Three, you're raising the next generation.
Right.
And I mean, that's the thing. It's like how sometimes they go the complete opposite side of the spectrum. You know, you can do the best by your kids,
right.
and
that's all you can do as a parent. You know, really have to give them examples, you show them the way, and it's their choice.
Mm-hmm. So professionally, 20 years. You've got 100 years. Your family's got a long-standing. I'll ask you that next.
All right.
So the lineage of the Kuwamura legacy, from your parents to your grandfather, to you who you are now.
Right. So the lineage is amazing. You know, my grandfather came as a farmer from Japan. Came as a farmer. Started in the valley. Had big Japanese farms in the valley.
Bringing those good vegetables.
Good vegetables. Good, ruby reds. The whole deal. You know, they were really good. From there, he moved to San Antonio and started a trucking company and restaurants. And he had restaurants and trucking companies. At one point, they were shipping produce. I mean, in Texas, we have some of the best produce in the world. I mean, we really do. And they were shipping these products to Florida, to California through a trucking company. So he was an entrepreneur, but I think before entrepreneurs were entrepreneurs, trucking and restaurants and things like that. And then my parents were both here from San Antonio, the Zazamora and Commerce Street. Wow. And so, and they understood that education and doing well was really important to better your life. So both worked for the government as GS people in the State Department, and just some place called NOAA, which is, they made maps. And both did very well.
NOAA, that's what, okay, they made maps.
They made maps, right.
So are those like the maritime maps too?
So they do maritime maps, and my mom was really the head of the mapping for aeronautical airplanes.
Dang.
You know? So it was really pretty amazing.
That's really in depth there. I mean, you have to be brilliant.
Well, they're very smart people. So I'm blessed. Truly blessed.
Well, yeah, I mean, any aeronautical maps, that's very sophisticated stuff. Now, explain that. So you were saying there's an equivalent of, if you're in the military equivalent to the government sector.
Yeah, my father, retired. They both retired after really long careers. One was a GS-18 and one was a 16. So for our military people, or GS people, that's really a pretty big accomplishment. And so I'm very proud of what they've done in their lives and their accomplishment. And they were good examples for me, myself and my sister. Led me to the drive, gave me the drive to do better.
Is your sister entrepreneur?
My sister is an attorney in D.C. and she has her own law firm and does extremely well. Yeah, she does well. Yeah, you don't want to go after her.
You want her on your side?
You want her
That's a woman you want on your side.
You want her on your side.
Don't piss her off.
Don't piss her off.
Okay, so what motivates you? Because, I mean, really, a doctor like you, an MD like you, a provider like you is doing short of a brain surgery. I mean, it's critical. The operating room is absolutely critical. You come from a trauma background.
I do. I was a trauma surgeon in the military.
That's remarkable.
Yeah, it was great. Being in the military, Gulf War, trained in Bethesda, went overseas and treated our troops, and during the Gulf War time period, it was really gratifying.
Wow. And I got goosebumps. I bet you saw some crazy stuff.
We saw some bad stuff, but we were able to help a lot of people's lives.
Mm-hmm. So you went from trauma into this.
Into spine.
Into spine. And how does that influence your practice now?
It really kind of led me to the very beginnings. In trauma surgery, what I saw back in trauma surgery was the thought process of doing things minimally invasively. Trauma surgery evolved. There were a lot of things, research being done in trauma at the time, about how can we save people's lives without really cutting them wide open, which was what the standard was at the time. That led me to then think, when I did spine, I trained at an amazing place in Florida with this world-renowned surgeon, and that was his mentality too. He was an inventor. He was a guy who we were inventing things in his practice. I mean, things that we see now are some of the things that he invented. And so the thought was really always, again, why can't we? Why can't we do it better? So I kind of started with a minimally invasive thought process in trauma, and then brought it into my everyday practice.
So the term minimally invasive isn't a standard in the medical community.
It's growing so. So I'm glad to say that. I think that why if we're gonna perform surgery on a patient, there's ways to do things now with technology, whether it's imaging, computer imaging, or stealth type things that we can use that I don't have to see you or cut you open to do the surgery. I can go through tubes or through poke holes to do the same surgery. It's like the old time, the orthopedic surgeons, when you had a knee problem, they used to make long cuts to expose your knee. Now they're doing things arthroscopically through tiny poke holes.
Yeah, it's wild. It's wild. I know you have a bunch of guns.
I do have a bunch of guns.
So you're like your military background?
Military background.
Well, we're in military, so
we
USA.
are proud to be, right.
Do you do any stuff particularly with vets or?
We do serve vets. We in our practice we do offer our services to all the vets that we see and all the VA people.
Awesome. So I would imagine, because you have firsthand experience doing trauma in things like the Gulf War.
It gives me a background. Some of the things that we see is that I think that unless you went there, when they talk to me about their history, some of the vets that we see, and they say, hey, I did this or I was injured like that, I could relate to seeing that type of injury, which unless you experience it and do it, you would never know the kind of jobs that these people, we have amazing people in the military, and they do really hard jobs and sometimes very dangerous jobs. And unless you've seen it or treated them, I think we don't have that perspective.
Wild. So if there's a shout out, any military people who are watching, one, we want to thank you for your service,
Absolutely,
but two, if you have any issues or any orthopedic, bones, knees, joints, back issues, by all means, go visit Dr. Kuwamura at his website is mdspinecare.com. You have a new office.
We do. We're moving to a new office. We're expanding we're in Stone Oak. Our main location is Stone Oak. We have another building that we purchased on Fredericksburg Road. That should be open in the next 3 months, but our new office should be open in the next month and a half, which is in Stone Oak.
And that's you're tripling the size of your office.
Oh, we are.
You're that busy.
We're expanding. Yeah.
That's exciting.
It's really exciting.
So in Remington Oaks, off of Stone Oak.
Off of Stone Oak is our main location.
So 2 locations.
And then the second's over Fredericksburg Road in the Medical Center area.
So Fredericksburg Medical is your area of choice, or the Stone Oak area. He's got 2 locations serving San Antonio.
Yes.
You were just skiing
We're in Breckenridge, colder than heck, but it's a great time.
Yeah. No joint issues.
No, I did. The goal every time we go skiing is don't come back in a cast and don't come back, with something blown out. Which, thank goodness, I didn't do it this time.
Knock on wood. Knock on wood. I heard you guys had a great time.
We had a great time.
Awesome.
It's a really good family time to be away and ski.
I want to ask you. It just dawned on me. What is your opinion on the whole medical cannabis?
It's a great question. I think that I think there's use for cannabis. I think there's a lot of studies now that use cannabis at low dosing to help patients that are in pain. So I think that for us to think that people aren't in pain, I think is ridiculous. People have pain for a lot of reasons. Either it's injuries or an injury to the body or other reasons. And so we should use every reasonable thing to help people in pain. And cannabis is really just something else that can be used. I think it needs to be regulated, be regulated by the government or some agency. But in the right use, in the right person, the right place, I think it's acceptable.
And you have your own CBD.
We do have our own CBD brand, right?
That's awesome.
Because I saw in Texas, of course, all our CBD products, which are have the natural healing portion of the plant, can't have cannabis in it or can't have THC. So what I did is I researched some companies and came across a company in Florida that will produce the products for us with a guarantee. The guarantee is really it does not have THC in it. So I was really looking to that, to be compliant within Texas guidelines that we can offer products that I personally use too, that can help with healing and inflammation, that again fit our guidelines at this point.
That's exciting. There's a lot of stuff happening in that world.
No, and everything it goes towards the mentality of wellness. Our surgery is the last thing. I mean, surgery is every patient we see we tell them, you don't really want me to operate on you. You don't want it. Let's see how we can get you better, whether it's through diet and exercise or other things that we offer patients. And the vast majority of patients we see in my practice, we don't operate.
Really?
Yeah, no, it's true. Which is kind of strange for a spine surgeon to say, hey, I don't operate, but which
I didn't know that about.
Yeah, and so that it's really important. And the patients that we operate on are the patients that have failed all conservative things, and they come to us and say, just like I did. I mean, I had surgery in my back, and so failed all conservative things, and we're the last step. We're the last step that we can help people with.
So is it like a signature prescription that they get from you? Like, hey, you need to go try. I mean, it's really coming full circle now that I'm talking to you and understanding the entrepreneur, the discipline, the mindset of you. I mean, shoot, your grandfather was bringing in holistic things from Japan.
Yes.
And my father always used to say, anything that grows out of God's green earth is good for you.
It's true.
And now we have cannabis.
I think we're coming back. Right.
So you try and avoid surgery, even though it's minimally invasive.
Even though we have amazing, I tell patients, look, we have all these great tools and bells and whistles and things I can do. Let's keep it on the shelf. But if I see the patient and I can make them better without surgery, that's a win-win. It's a win-win. And the other thing is that the patients that really fail surgery, they know in their hearts and mind they need surgery.
How do you do that though? How do you send somebody out the door and fix them without?
Well, it's through those things. We have a lot of patient education in patients is really important. So we educate them on wellness. We educate them on healing, or CBD products, or vitamins, or diet, exercise. Weight control, right choices in life. It's amazing if we make right choices in life, we can really fix a lot of things in our life.
Isn't it true?
It's true. Right. It's hard to do. I mean, I struggle with that all the time, but
right.
I mean, I love my food, so but I have to make better choices. That's my resolution to 2020: live a cleaner life, be better.
Wow. Well, I totally understand why, but to me, it's not something that's like, this is a new thing for you. This is something that you've done your whole life.
My whole life, and it's the beginning of my professors. All my professors were the mindset the same way. We have amazing things we can offer patients in surgery.
Your professors?
Really, my professors, yeah. They had the same mentality.
Really?
So I'm really a product of my education, and they were all thought the same thing. So we were doing research and cutting edge things, but they said, look, it's only for the person that really fails conservative care.
Wow. Last question. As an entrepreneur, what do you think has been the biggest challenge and the greatest reward from when you had a thought that you were going to start your own practice to 20 plus years later? Well,
being an entrepreneur is really hard. I think it's extremely hard. And so I've kind of read some books and I've kind of did some research. And
dabbled in books.
And it really kind of, and interesting, what I really believe is that the mindset of a true successful entrepreneur has to have really multiple personalities.
Wow.
So here we go. Watch, multiple personalities. There has to be in a successful entrepreneur, there has to be the worker. The person that comes every morning and says, I have 10 things to do, and I'm going to work through my 10 things to get done. So that's one personality. The second personality is really the person that says, I can manage this, I can manage the operational portion of this. And then to be really successful, you have to have that why can't I? I mean, why can't I make the sky purple today? Right? No, I don't know how to make the sky purple or make the grass yellow or blue or whatever, but I need to have those thought process of always asking the question, why not?
That's beautiful. Multiple personalities.
Yes.
So I can tell my therapist that Dr. Frank Kuwamura says I'm really okay. No, I'm kidding. I don't have multiple personalities, but I think that's fascinating. As many entrepreneurs, I've interviewed over 10,000 entrepreneurs, and nobody said something as unique as multiple personalities. And it's brilliant.
It makes sense. We have to have that drive within us to ask why. We also have the discipline to finish tasks and to see a vision and be operational. It's hard. I struggle.
We all do, but that's what makes us human.
Right.
Well, thank you so much.
Well, thank you so much.
Fascinating interview. I mean, we have a ton of viewers. If you're here, let us know where you're watching from. I know we were trying to ask the question of how many bones people had broken, but Laura's saying hello. We've got some people that are joining us live. Thanks for tuning in. We're live at MOAD right now with the wonderful, amazing orthopedic surgeon, Dr. Frank Kuwamura.
It's been a pleasure.
Two locations on Fredericksburg and Medical, and then a brand new one at Remington Oaks. It's huge.
It's gigantic.
It's going to be
big. Great. It's exciting times.
And you have some really cool stuff. I mean, you don't just, there are other things that you do that would appeal to the general public.
Oh, absolutely. We believe in massage therapy. We do spiritual things for patients.
Wow.
We do vitamin supplementation. We're starting a whole wellness program in our practice. Again, It's kind of the same idea. Be well. Be well in your life. Be well in your in your mind. The cliche thing, which is the mind, body, and spirit.
Wonderful. Well, you can see it's not just a practice for him, it's been a way of life. And that's the wonderful story that we get to tell about what it takes to be somebody who's at the height of his career, at the height of orthopedic surgeons around the U.S. He's got patients that are setting world records, and like we said before, I mean, the spine isn't something that you play around with. It's very fragile. We're all grateful that we have a back and we can get out of bed, but when you're doing something that's as competitive as that, like that testimonial is freaking huge.
It's huge, yeah. And he's just one of many stories we have, and that's really the most rewarding thing is to meet the Jamie, meet the person, meet the other people that really change their lives.
Yeah, yeah. Well, on behalf of our viewers and me, thank you for changing people's lives.
It's my pleasure. It's really a love to do that. And it's the most gratifying thing I do.
Awesome, awesome. Well, stay tuned for more upcoming developments from Dr. Kuwamura and MD Spine Care. Again, go to his website, mdspinecare.com. Also, there's a couple other pages. His Facebook page, go like and share on that. I mean, you really wouldn't know that you've got 100-year native. I mean, when you talk about long-standing roots in the San Antonio area, somebody born and bred, somebody who's completely on the military sphere, military USA, your background, your Boston University background. I mean, you've got
truly blessed.
Yeah, you've got a huge, an amazing pedigree, and
thank you. No, I've been truly blessed. I'm truly blessed.
That's what makes you great. That's what makes entrepreneurs great. The successful ones is they're just like Dr. Kuwamura. They're as humble gets. Anyways, so this is Rachel tuning in from Extreme. I appreciate all the viewers. Let us know where you're tuning in from, and then stay tuned for our next upcoming episode live from MOAD. Y'all have a great start to your 2020, and let us know what those New Year's resolutions are. Hey guys and gals, this is Rachel. Do you have a business that you're trying to get to the next level but need a little more inspiration? Check this out. We are at MOAD, San Antonio's fastest growing, most exciting workspace. I don't know if you knew, but 2 billion people are virtually employed. So folks, this is not a trend. This is now, and this is the future. If you need all the formal settings of a conference room, workstations, Wi-Fi, free parking with a not so stuffy office feel, consider a membership at a MOAD.